We have a picture of our panelists here. So the first thing that I will do is put in a plug for social impact partners. We have released just yesterday our 10-year impact report. For those of you who haven't had a chance to see that, I encourage you to take a look. It does a great job of laying out our vision for a thriving Connecticut and equitable access to high quality education to sustainable livelihoods. Our commitments are advancing social and economic mobility. It also, in our 3 focus areas, really lays out through case studies and stories, our dual approach of both working with organizations on high quality, high impact, direct service, community level organizations and helping those groups to grow, to strengthen, as well as working at the statewide level and addressing structural challenges, barriers to access, making the case for public investment, improved data and more. So seeing that laid out side by side in our impact report is something I encourage you to look at. It also begins, and as we'll see here, to lay out that North Star that we have around increasing living wages for all residents here in Connecticut. And I don't know if we can put
this up as a slideshow.
Put it in the presentation.
Oh, would you like to do that? Yes.
You have to do that because
Okay. Yeah. So let's see. Give me 1 minute while I set this up as a slideshow.
Can you see it at the top bar there?
My bar is a little. I'll just click.
There you go.
Yeah, perfect. Yeah. All right. Thank you. So first, we're going to jump into this foundation setting and are connecting the work of our vision and our opportunity divides that we see here in Connecticut, which we know for far too many children, it's starting very early in life. It's starting at the earliest stages where so many of our families, the majority of our Black and Hispanic residents in the state and nearly 40% of our state residents just don't make enough each month to meet their basic needs. And of that, we see that our current child care subsidies, which can really help meet those basic needs of rent, food, medical support with prescriptions, childcare is a big part of that, and yet our subsidies only reach about 17% of children under 5. We also see that over half of our low and middle income Connecticut children really aren't able to access high quality care. For a variety of reasons, we know that we have a lot of deserts here in Connecticut, but also there's the key issue of affordability. So our shortages here in Connecticut are significant, with the majority of our shortages being in infant toddler care, which is where it is most expensive to provide. Again, I'm sure something I'll be talking about in the panel about those significant needs in infant toddler care. And then finally, our workforce shortages are not insignificant here in Connecticut. When you look at these numbers, average childcare worker in 2023, $15.34 an hour. You can understand really quickly how that contributes to our recruitment and retention challenges, with turnover so high that many organizations need to really focus kind of consistently and constantly on that churn, bringing in new staff, training for that high quality care. And it contributes to these divides and these this broken market that we see in early childhood here in Connecticut. And so connecting those dots on these opportunity divides to this focus that Social Impact Partners has on early childhood education, we see 3 main areas here. One is helping children to be ready for kindergarten and ensuring that those opportunity divides, that when they open up early, that they don't open up early, because there's really the unique opportunity early on. But when we wait until after children are in kindergarten, it is much harder to close, if not very, very challenging, if not nearly impossible to close those. Second is that when we can enable parents to work and really support, and this is in particular for mothers, when we can really enable mothers to be at work and not to have that interruption at work because they're home with their child, we can focus and support them. And that helps the whole family because it contributes to the stability of the family, the strengthening and meeting of those basic needs that we just saw a bit ago. And then finally, living wages for childcare workforce. We see the numbers. We know this is an issue, and yet this is such a significant and important time in children's lives. And to ask our workforce to be providing that high quality critical care, and they need to be paid those living wages. And that's why public investment we know is so important, which we'll get into talking about shortly. Many folks have seen this slide, so I know that this is not a new chart for people who are on the Zoom here and in the room, but it's really important when it comes to kindergarten readiness to note that this development, there's a unique period between ages of 0 and 5. The brain is really being wired for sensory pathways, language for that higher cognitive function that will put children on the trajectory to that long-term success in school and in life. So taking all of that together, laying out why our work is so focused on this crucial area of early childhood education, I want to, at this point, I'll turn it over to our executive director, Mark Argosh, to talk about some recent research and momentum that we're seeing in Connecticut to really address these systemic issues, and also what Social Impact Partners is looking to do going forward.
Good afternoon, everybody. As Skye just pointed out, one of the main arguments to provide more funding and support in early childhood education is the impact on our workforce. In other words, early childhood education isn't just an education issue, it's a workforce issue. And we've seen evidence of that in other places. So famously, Quebec, Canada, for 20 years has had universal early childhood education that was affordable for all families. They have the highest labor force participation rate among women in the world, actually. And that system is being rolled out across Canada. In the US, the District of Columbia was very early in kind of doing universal pre-K and even going down into earlier grades, earlier ages. And DC has the highest maternal labor force participation rate in the country. And so now this study comes out from Yale, from their Tobin Center for Economic Policy. And it is as high quality research as you could get because it's a randomized control trial. By virtue of the fact that the New Haven public schools have a lottery system. So there were families that could avail themselves of universal pre-K, and there were families that did not win the lottery. And they were able to compare those families for over 10 years and be able to see, well, what impact does it actually have on workforce? And it turns out parents' earnings of parents of children that were in the program was 22% higher than earnings of parents that weren't in the program. They worked on average 13 more hours per week. This is kind of now, and this study was not only worked on by Yale, but also by other economists around the country, published nationally. And this is at this point kind of the most seminal piece of research in the country about the workforce impact of early care. And this is actually around preschool, but we believe this also holds true earlier because the main point that they were able to quantify is, and this continues on, by the way, not just for the time period that kids are in school, but for years afterwards. The reason is because primarily the women we're talking about here's careers were not interrupted. they were able to continue to build and continue their careers as opposed to working, having to go to part-time status or not working at all. And that's really the difference maker. Well, just imagine if we had this for infants and toddlers so that you wouldn't have to have, parents kind of essentially kind of get off of their career trajectory in work. So this is a really critical workforce issue. It's a critical issue for families. It's also a critical issue for employers because employers are basically struggling to find people. Let's shift to the next slide. To achieve our shared goal of building a system.
Sorry, I just wanted to let folks know, I quickly showed the infographics and we put that infographic into the chat and we'll share it out after.
Yeah, encourage everybody to read the study if you'd like. So public funding, you kind of, there we go. To achieve our goal of building a childcare system that provides equitable and affordable access to high quality care, we need more public funding. Programs today are limited in terms of their growth potential because they have, there's a limited number of slots that the state is willing to provide kind of subsidies for. And this, as Skye said, only 17% of families can access subsidized slots. So this leaves a lot of people not able to be able to access childcare. It leaves programs kind of not being able to, meet the needs in their communities. And so this is a critical problem that we have to solve. We've been involved with the Blue Ribbon Commission work of 2 years ago, where we SIP worked very closely with the Office of Early Childhood and with other stakeholders to build a plan for the state that, by the way, calls for $2 billion of funding over the next 5 years. We've worked with the Office of Early Childhood, and really importantly, you're going to hear today from Ava Bermudez Zimmerman, who leads childcare for Connecticut, and that's one of the key advocacy groups that's really leading the kind of effort in the legislature to try to get more funding in childcare. We are cautiously optimistic that this year will be a significant breakthrough in this whole effort. Sometimes it takes a little bit of time. We saw some additional funding last year, literally months after the report came out. We're now a year after the report came out. Our hope is that the governor and legislature are going to make a significant commitment to make Connecticut the most, as the governor oftentimes says, the most family-friendly state in the country, which leads us to kind of our strategies. So we are focused in three main areas in terms of early childhood. One, and this goes to Skye's point about how we work at the community level and at the system level. We are working currently and intend to expand our work with more early childhood providers, especially center providers, and helping them grow and helping them kind of strengthen their efforts, their program, their financial sustainability, in order that they can increase the number of slots. In other words, expand the supply of high quality childcare in their communities across the state. And we're going to be working region by region with key early childhood providers to build really a stronger system from the ground up around the state. And so our building these partnerships with early childhood providers is really a critical part of that. We're going to hear from a couple of our partners today in just a second. The second thing is we are continuing our work at a system level, which involves trying to get funding, trying to build out the data systems and other supports that support parents and providers. So we are continuing to do work with the Office of Early Childhood. And then finally, as Skye said, building the workforce in early childhood is one of the most critical areas. You talk to anybody in early childhood education, they say, if we can't build the workforce, meaning the teachers and other workers that support students, we're not going to be able to grow our system. And since workforce development is an area that SIP is very actively involved in, we're going to leverage some of that knowledge and expertise to build out more programs in schools, both high schools and colleges, apprenticeship programs, which are now starting to happen around the state, and support, especially for the existing workforce, the quote incumbent workers who are already committing themselves. And a big part of that is seeing that they can earn more compensation, both salary and benefits. And that's a part of our work on funding, is to try to ensure that that the workforce in Connecticut gets paid living wages. So with that, I guess we will go to the panel, right?
We'll go to the panel. All right, let's see. Thank you. Okay, thank you, Mark. We wanted to give a significant amount of time today to discussion. And I want to just thank Jennifer and Patrice again. Ava will be joining us. Ava is looking hopefully to join us, might be a little later, so we may hold some advocacy conversation until then, although we can certainly touch on it. And I'd like to also recognize that there are some SIP volunteer partners who are working directly with Patrice and Jennifer. And so I'm going to ask you to, might call on you. I've already prepared Tim, might call on you a little bit, because I think the real opportunity here is to show some of our first partnerships with providers working directly with young children. And so we really want to grow from that, to learn from you, and make this an experience for our volunteer partners to learn about how they can really lean in and what that will look like. So I'm going to stop sharing so that we can see here. Okay, how's that? There we go. Okay, I will read, I have some shortened bios here, so I'll read a bit about Patrice and Jennifer, but we'll also put a link into the chat so that you can look at the bios in more detail. So Dr. Farquharson is with West Haven Child Development Center and is currently in her 45th year at the center, and now has 150 children there. Space for more, so we love to see that growth, and so many partnerships. The work with the National Association for Education of Young Children has really focused at these intersections of social emotional competence in young children and early childhood education. Also with the National Association of Pediatric Nurse Practitioners, this intersection of health and early childhood. And I'll read it's been recognized by the White House and CDC in collaboration with the White House twice, most recently in 2015 by the American Academy of Pediatrics as a promising practice in 2016. And there's more to share as well, and has received her Doctorate of Education in Child Studies. So thank you, Patrice, and thank you for your leadership. And Jennifer is the Executive Director at Riverfront in Groton. And that is an area where, many folks on here may know that there's such a significant need in Connecticut for, children of all ages 0 to 5 in Groton. And we hear that from Jennifer, the waiting list, it was binders, I think you said when you first came in, and you've done so much work there. We're really looking forward to what's next. But I love that you spoke about in your bio how you began working with toddlers and fostered a love in the field, and since then have really worked with children of all ages, infants, toddlers, up to pre-K school age, and then moved into assistant director, and now ED at Riverfront. And you have your master's degree in early childhood education, and how learning from this, more successful programs and the variety of centers you've worked for has, and the challenges and the ones that haven't been as successful, how that has all informed your leadership today. So thank you for joining us. And then Ava, I saw that Ava joined us too. Hi there. Great timing. Good to see you. I like the, oh, I also want to say Jennifer was recently married. Congratulations. So we had to change her last name.
Which was what
and-
before? Is that correct?
So it's now Smith. And Ava, thank you for joining us. Great background. I'll recognize the new logo. It looks fantastic there. Ava is the Coalition Director at Child Care for Connecticut. And before that worked at SEIU Local 2001 in the child care and organizing space, where she fought for affordable child care, and has 16 years of organizing experience in helping communities gain access to childcare and healthcare and really improving the lives of working families, and a lot of that work here in Connecticut. Ava is also on the board at ACLU Connecticut and is a director in the Paid Family Medical Leave Authority. So with those introductions, we'll move into the conversation. And I'm going to start out, I know we've talked a lot about the challenges. Jennifer, maybe I can start with you. We've talked a lot about challenges. But can you let us know what ways you're excited about how your organization is supporting young families in Groton?
Yeah, so at Riverfront, you can hear me okay? I should ask that first before I get too far ahead. You can hear me?
Yes.
Okay, great. I was having a poor connection earlier, so I just want to make sure. At Riverfront, I think we make a positive impact for at-risk families through, we have an on-site free choice food pantry. It's open for families throughout the day, so they can go in and shop for basic needs. There's hygiene in there and food. We do referrals to social services. And we have an in-house scholarship program that makes early education affordable for everyone. Riverfront does not turn away eligible families due to their inability to pay. So when family payments plus government subsidies fall short, we then apply our in-house scholarship from our Scholar Dollars account to fill that gap between the cost of care and what families can afford. Studies have shown, obviously, that children who participate in high quality accredited early learning programs are more successful. They have more confidence. They develop more satisfying interpersonal relationships in their lifetime. And by nurturing children and giving them that solid foundation for lifelong learning, I think Riverfront's preparing adults of tomorrow to find meaning and purpose in their lives, show empathy and compassion towards others, and hopefully carry some contentment and joy in their hearts.
Thank you. It really is special to walk through the space and to see what you've described in person. And Patrice, can you share with us? I know you've had many innovations in your program.
Sure. Well, currently I do have to make one correction, Sky. It's now my 46th year. I wrote that starting in October 28th was 46 years. But anyway, so just so you know, I started as an assistant teacher, so I kind of know the needs of, I've always looked at the needs of the staff and what I would have wanted as an assistant teacher at the time, and that was many years ago. But so I've always built on that it's important to make sure the teaching staff needs are met. And you know, it is difficult, but you know, we try to do that, and we did that by partnering with a lot of different agencies throughout the years. In order to meet the needs of the family, we are funded, we're one of the original child daycare centers, funded back in the late 70s. And so there was always a subsidized program, but the fee is based on your income and family size. So there is a fee. And then for what we did we noticed we had more needs for infant toddler, which your presentation supports that, was that in order to meet even more of our population in West Haven, because it has changed tremendously in the 46 years that I have been here. It's a whole different city, that we partnered with United Way of New Haven to offer an early Head Start program. So they received the grant and we subcontract with them. And so there's 16 infants who are under our early Head Start program, and there is no fee for that program. And there's a lot of support services, but the support services also benefited the rest of our infant toddler program. So we partner with the diaper bank for free diapers. Nobody brings diapers. Nobody brings any food because we're on the CACFP food program. Even infant formula is provided. So you just have to bring your child and, we'll do the rest. So, University of New Haven is in West Haven. So if we reached out, we partner with them on different areas. And we also have Yale School of Nursing is now in West Haven. So we've had a partnership with, I'm a member of the nursing organization. I am not a nurse, but and my sister is. So I joined that organization when she became president. So there was membership. But I'm an other, but I have learned a lot from them, and it has helped us with focus on the health, yet not only the educational piece, but the health. And we had a nurse on staff for several years now. And when my nurse retired, I contacted Yale, and one of their nurse practitioners who was already an RN took the job part-time. So while she was working on our advanced degree. So all these collaborations have really helped strengthen the program. We were part of the Farm to ECE program, the initial one. And so we partnered with a farm to offer CSAs, farm shares, to our parents. So, and that's been fresh. They love that, the day the fresh fruits and vegetables come to the center. So that's just
Thank
some of the
you.
things, I'm also in many other areas, but that's just to give you a synopsis. There's 150 children here now.
Thank you. I appreciate that. You gave a nice range of everything, and walking through the space, you can see, how that comes together to support the children, and really the joy and the learning there. So congratulations on all of that. Moving from what you are excited about, I mean, it would be good to talk about the challenges. We covered some of them. I'd love to hear specifically from Jennifer and Patrice about regional challenges, and then turn to Ava to speak a bit more broadly, and from the perspective of advocates, and you have obviously parents and providers and the network and the coalition. But Jennifer, why don't we start again with you on challenges and some things that are unique regionally?
I think speaking to what's unique regionally, so we are directly across the street from Electric Boat, who's just increasing hiring year over year, and driving a lot of families to the area, families who need housing, because in this region, we are having a lot of problems. I think it's statewide, but problems with housing. And there aren't the availability of slots for the children. So they're coming to the region to work for EB, and they're hitting a roadblock for housing, and they're hitting a roadblock for childcare. So with an expansion of families, we're looking for an expansion of all services. And, I think I speak for we, as all childcare is in the area, we're having a hard time meeting that need. It's difficult to expand. And I think it's difficult to expand for two reasons that come to mind. But between poor working conditions and low pay, we've seen the interest drive away from early childhood educators. And so there's less people coming into the field. We hear from the higher education, the colleges in the area are letting us know that we are not having the same kind of interest in those programs. People aren't going to school for early childhood. We're not seeing the same amount of qualified staff apply that we used to. We're doing the best with the staff that do apply. So it's a huge investment on our part. We do a lot to partner with them, provide professional development, training, work with them to get their degrees. And then because early childhood is not regarded very highly as a profession, we do see them leave once they're qualified to public school and the Office of Early Childhood. And the other obstacle is the stability of funding. like you mentioned in the presentation, there are only so many slots. And so everyone's kind of vying for the same amount of slots. And our funding sources aren't consistent. They're in constant movement. I mean, I've been in this position for 2 years and I've seen it shift multiple times. Right now, we're looking at CDC and school readiness all, streamlining into this early start, which is great, but it's just another change. And even with that change, we've seen more changes come down the pipe with that. So it is very hard when you're trying to project what expansion could look like and the possibility of maybe, procuring another building or expansion into another space when you don't know what your funding source is going to look like in 6 months, 1 year, 3 years.
Great. Thank you. Thank you for being, and also mentioning that even as there are, there work at the systems level, and that is in some of the statewide plans to, address those challenges, address those kinds of barriers to getting the payments into so many different submissions into the state. That takes that time it takes, that transition period is also, the reality on the ground is that then you're grappling with that within your systems, and it just takes time, even with the best plans and intentions and all of that. So let's turn to Patrice to talk a bit more about that, about West Haven and the New Haven region.
Well, and West Haven too is designated as a child care desert according to the Office of Early Childhood in the state, which means that it just doesn't have enough slots for or spaces for all the children that could use the care. But also we're facing a lot of the same challenges, obviously, as Riverfront. And we do see that many of our staff, particularly after the pandemic, are leaving for other fields. They just don't want to work with children and they're getting higher pay. In fact, I did have a staff mentioned at the beginning of the presentation. I had one to leave to be a dog walker because she could set her own hours and the pay was higher. That is true. But that was, she did not have an early childhood education degree yet, but we work hard to get our staff. We have always worked hard to get our staff to the level of the bachelor degree. But now we're finding that we're starting all over again because those people have left for many other positions. You're competing with everybody else within your area. We used to be one of the higher paid. We were able to pay our staff higher than most programs, but it's not about the pay really now. They want more flexibility. They want shorter work week. So if they can find a position that gets out at 3:30 and they have the summers off, you can't blame them. That's what they're going to take. They're still raising families. They have the same responsibilities. In fact, we're not even talking about just our families now. We're talking about the staff that have food insecurity and housing problems. And, it's just the way the economy was. So those are some of the challenges. We just got, the mayor emailed me yesterday. What am I signing? What is this I'm signing? She already signed the contract for CDC, but then there was an amendment and she had to sign it again. And she didn't know what that, because as they're revising this, it's impacting us. And, frankly, we were trying to put a budget together from October 1 of this year until September 30th of next year. It's very hard because we're not sure, of all the funding that we might receive.
Yeah. And there are different intermediaries working with, so you're also working on that relationship with the city, and making sure that they're up to date with what's coming down from the OEC is another, the Office of Early Childhood is part and parcel of that planning for the future for you right now. Let me ask Ava. You're going to have a different perspective that you bring to this, but how would you, speak broadly to the challenges? Because I know that you talk with providers and family, parents every day.
I think
it's important to remember, and hello, everyone. Thank you for having me, sharing this space. It's important to remember that the perspective from the provider and from the parent is not always in 100% coming from the same place. So what I've learned in our coalition building is making sure that parents first and foremost understand the sacrifices that owner operators and childcare educators are putting into staying in this career. And a lot of parents have misconceptions. You know, there's a question of, well, I have to pay $20,000. So that means that from the money I pay for my child, my educator is getting paid a good portion of that, not really and truly understanding that the take-home salary of their teacher for their child and the owner-operator is barely surviving. You know, they're holding on. And most likely the $20,000 that that parent is paying is not even the entirety of the true cost of care for that facility and for that location. So as a coalition director, as someone who has been navigating policy and advocacy, the first step as a coalition that we were taking is educating the parent to understand what the crisis truly is and educating the provider. You know, let's live in someone else's shoes. If you're a provider, see it from the perspective of the parent, the hardship, the difficulty. And if you're a parent, understand that the system's truly broken and the person that you're interacting with every day is doing their darndest to just survive just like you. From that, building community, building, you know, starting from a place of understanding, it's really allowed us to grow a network of warriors, of people who want to change the system and not blame each other, but understand that together they can do something different. As a coalition, we're now in our fourth year, entering our fourth year of an action called Morning Without Childcare that went national for a day without childcare, where here in Connecticut, we do things differently. Nationwide, there are certain states that strike. They shut down for the day of action. Here in Connecticut, to not put the hardship on the providers closing down for a day and the parents not having childcare, we ask before or after the childcare day has started for actions in local communities and spearhead these actions by parent providers, sharing the stories and sharing the hardship and calling for elected officials to do something about it. We're in a place in Connecticut where we have the money, so it's very unique to say, hey, elected officials, come help us, knowing that there's money in our coffers, but also understanding that it's not that easy, right? So from the advocacy point, people are waiting and ready and willing to innovate, to be creative, to think outside of the box, to do something that really helps providers and parents. It's now just a matter of seeing if in the next legislative session, we can take those ideas and that innovation and put it into actual implementation.
Thank you for that. I really appreciate having the three of you on this panel together. I think we've hit on a lot of the themes. I'd like to kind of circle back because you know, one, that perspective that you can provide, Ava, at the state level, and we'll come back to what we might be seeing in advocacy in the upcoming legislative session. But I think, you know, Jennifer, you really hit why this is, to Mark's point, this is a workforce, you know, issue. It is an issue that we see employers are very concerned about because they know we have, you know, estimates in our plans about what it will mean for the state, for women in particular, for mothers to be able to work. And you brought that home really well with the conversation about, you know, what being right across from electric boat. But to Ava's point about innovation, so as constrained as the environment is, you've both mentioned different innovations and ways that you're going about your work, your strategies. So I just ask you if you could highlight an innovation that even in this kind of constrained environment you feel holds promise. And after this, we're gonna lead into ways that our, our SIP teams can help lean in on your businesses as well, but keeping that in mind. So Patrice, why don't we start with you?
And then, well, one of the things that I did, and this fits into the workforce development, I don't know if you, this is what you're considering, but I started, I work for 2 universities, and I got right at the beginning of online training, over 20 years ago, 28 years ago, maybe now, but, and I designed courses, and I always said to my education coordinator, why can't we just design our own? And, I knew that you could get credit for training through Charter Oaks State College. And so we did that. We designed a series of 5 courses that are worth 3 credits each. We aligned them with the CDA in case somebody wanted to do that. And, it was a way for them to start getting course credit without having to be, all the fees for the colleges, go to the college. It was online. They could do it here. And we would support them in that. And it was very, very successful. It's been over 10 years now. I'm just finishing up a 9-week training one for New Haven. And it was great when it's free. We don't charge that much, but then we open it up to the public. But several of my staff have gone through it. I have one today who's being interviewed for her CDA. And it's a way for them to start. And then they can go on, because we receive state funds. They were eligible for scholarships through the state to receive, to move on with their degree in early childhood, which many have done. So I just keep going back through the cycle.
And you've been, just really seeing how you engage your staff in whatever ways you could be, the mentorship, however that you can,
Right.
bring more to staff salaries and things, and retain your staff is really laudable. And it's one of the reasons why I think we're excited for this partnership, and to be able to work with you further on that leadership development aspect and how you build out your organization. And Jennifer, what are your thoughts there?
So 2 things come to mind. I believe we're innovative when it comes to our Scholar Dollars program. So it's closing that gap between what parents can afford and the true cost of care. So we do a lot of fundraising to build up that Scholar Dollars fund so that we can grant scholarships to families, and we don't have to turn anyone that's eligible away. And I think the other piece, we actually have a building on our property, and I had to make a choice early on when I started here, what we were going to do with that space. And certainly we could have expanded and we could have put classrooms into that building. But we chose to actually form a partnership with a family, with a program that provides autism resources resources for children with autism. And so having that partnership where they can come in and help train our staff and also help support and coach our families. We are seeing more and more challenging behaviors at this level. And there is a gap in services that I'm not sure if you're aware of, but we have Birth to 3 that covers children from birth to 3 years old, and then the services drop off. And sometimes public school will pick them up before kindergarten, but they're also constrained as far as what their resources are. And we see more often than not, children do not get picked up by public school, and the teachers are ill-equipped to handle some of the needs that we see come through. So the choice was to put a partner in that building that could support us with some of those behaviors that we're seeing. And I think in general, collaboration is the next step for early childhood providers. I think I've seen it shift over time. Certainly when I started out in this profession, it was very competitive. We're competing against each other for slots for teachers. I think Patrice sort of mentioned that. And so that is definitely still there to some degree, but we're not going to go anywhere if we can't grow together. And I do see us banding together more now than ever. And so I think that collaboration is kind of going to be the next step in this, the partnerships and innovative strategies. pooling together our resources and coming up with ways that we can help each other.
Thank you. Ava, do you have any thoughts to add to that? And actually, let me just take a minute. I should have said this before. If anyone has questions, please, you can put them into the chat. We have some folks that are checking out the chat and then here to us as well. Let us know if you have any questions that we can put in. But Ava, do you have some thoughts on?
To chime in some other innovations that some of our partners are doing, and I think it's phenomenal, including some of the work that Social Impact Partners is also participating in. The family home-based incubators, I think is a great beginning model. Also the statewide apprenticeship programs. 30 years ago, there was an apprenticeship program only in one location in the state of Connecticut in a childcare center. And then it sadly, after like 5 years, went defunct. And now to see in the last 3 years, like a resurrection of the conversation, funding, and childcare centers taking it upon themselves, and resource centers working in collaboration with centers to do apprenticeship models, I think is phenomenal. There's also a childcare statewide apprenticeship with family childcare spaces as well. And already in the course of 2 years, it went from having 20 childcare providers that were in the family space that had CDA training now to 60. So all of these are opportunities with the Office of Early Childhood and statewide initiatives that are looking at the focus of high quality care, but simultaneously trying to maintain doors open for providers, give them business opportunities. Other innovations that I've seen in more recent years, and I think it's because of the COVID pandemic, is the collaboration of nonprofits. So just to echo Jennifer, the same sentiment of infighting within providers is kind of where funding almost felt like, with a lot of nonprofits who talk about social subsidies and social programs. And I feel for the first time in a long time, after years of organizing and advocacy and doing policy work, that right now we're not fighting. We are working together. We are understanding that the issues that happen in housing are also interconnected to childcare funding, interconnected to workforce issues, that it's not, let's make sure we come out as the victor. This is about supporting families and not just focusing on one subset group, understanding that families is a wide array of income diversity and diversity from urban to rural communities. So I'm just happy to see that shift.
Thank you for reflecting on that. And I know you've been working both with, center providers and family care providers. So that, thank you for bringing up those family innovations. Janice has a question here. Can you?
Yeah, I can read it.
Thank you.
So Janice's question is, in addition to making pay competitive, how can we make ECE a desirable and exciting career path to attract talent?
Janice, you're on spotlight now. We didn't know that was coming.
Yeah, I wasn't sure whether I should speak it or say it, but I was just thinking as you all were talking about, what are some innovative and creative ways to make this, a career path that young people want to go into, and something that they're, excited about. So just wondering if you had any thoughts on that.
Oh, I can lift up one example that's pretty innovative. There's a child care owner operator in New Haven. Her name is Alex Schiavone, and she's been really identifying the lack of affordable housing for ECE staff and ensuring that they have access to housing so they could stay in the career. I think it's a very unique way. There's no other example in the nation that's pursuing that connection between housing savings that is specific to childcare providers. And there's other innovations that are coming from that idea with now conversations of the Office of Early Childhood of how can they better connect with existing programs to reduce the costs for providers so that they can stay in the workforce.
So this is Patrice. Hi, Janice. Well, this is what I think about all the time.
Yeah.
So how can I make it better for the teaching staff or to attract people besides just the salary? And you know, they also have to feel like a professional, you know, that they have to know that this is not just the babysitter. So sometimes I get concerned what we used to go from early care and education now to childcare workers. There's a big distinction between the naming of the profession, and that has always bothered me, that it seems now we're going to childcare worker and the goal is a CDA, and which is an entry level instead of a bachelor's in early childhood. And you want to make steps for them so that they can achieve. And I recently just took 5 of my staff who have been here over 20 years to present with me at a NIAC conference. So you have to make them feel like there are opportunities in this field as there might be in other professions to get out and meet colleagues and not just be in the classroom for 7.5 hours a day, 5 days a week without being out of the classroom and pursuing your own ideals. If I have a meeting and I can't go, I'll see if somebody else can go, or I'll put them on committees, you know, if they want to. I have the mentorship for those who can work, get paid a little stipend if I have funding. You know, it's always tied to funding, but you know, we write a tremendous amount of other grants for this program than the funding that we get. And so I think that's a way. I mean, some people do have the summers off if they've been here a certain length of time. Some people have set shifts. These are the kind of things that make the job more attractive. And to keep them in the field, you have to talk to them about what their needs are, just not, but of course we have to balance it with the needs of the program.
Thank you for that. I am going to move on to the other question and from Ben, and then ask about a little bit about our partnership, because there's so many volunteer partners on here. I want to give a little bit of a sense of what we're working on. But Ben, can you state your question? I couldn't read the whole thing.
Yeah, I was just wondering if there's any, hi everyone, and thank you, this has been great. I was wondering if there's any examples of towns or cities that are really looking to lead the way in expanding childcare for the residents. Like obviously universal pre-K would be the gold standard, but is there an argument that the ROI of providing the upfront cost of that is worth it if families end up settling in those towns, buying houses, and then you get property tax from them for their lifetime? Because I mean, the cost of childcare at this point is so high that it could totally influence where people end up living.
And Ben, I'll just make a note for you and Ava. I think you've talked about this being a personal challenge for you and your family, and I think that your story is something I'd love to connect you and Ava on after this. But any thoughts from the panel on Ben's question?
Well, I think one of the things is that we have to be careful, because towns are talking about in my town, city now, they Board of Education wanted to take over all the funding for early care, all the CDC, all the school readiness, and but they only want to do part-day pre-K, or they want to do after school. So it's a different kind of model than, you know, the kids would go 2.5 hours, but not the teachers would not stay. Then they would just it would be after school for the rest of the time. So when you're talking about universal pre-K, you're not talking about universal early care and education. That's a 10-hour day to meet the needs of parents. They're not talking about doing that, but they would like all the money to go towards the Board of Education to do part-day pre-K. So they have talked about that in our town, but that's just one of my, but other than that, no.
I think that's a good, I was just gonna say, this is a good distinction, because I think the term makes a lot of sense, and then really understanding what families need. And I do think that there are some cities that have put together incredible partnerships to really address, that are seeking to really address what families need. And Ava, you look like you were leaning in.
I just wanted to echo and add to Patrice's comment that some towns, another problem with some policy that needs to be switched here between municipal Board of Ed and the state is that there's no subsidy for after-school care or for summer care. And the municipalities that are really focusing, like Patrice mentioned, on universal pre-K, which there are some in, Connecticut, like Wethersfield also incurs the cost of pre-K programs, but it's a half-day program. They don't supplement the extended learning programs for that municipality, and then the parent is expected to pay for the difference of time for after school care, or even that half day to the end of their workday. And that's also a lot of money. Like even programs that are robust and have constant funding, I'll use Danbury as an example. It's all self-funded. The municipality doesn't fund it, even though they have a philanthropist and other donations that maintain it. So constantly the program has to be self-sustaining and looking for funding every single year. The other add-on, and going back to like the innovation question, New Haven here in Connecticut is an example of a town, a municipality that's really trying to look at creative ways for what universal childcare could look like from 0 and beyond. Obviously, they're not there yet. Obviously, it costs a lot of money. Something that they do that I found very interesting is that they provide transportation for the parent who has a child in a half-day program to in a public school half-day program to then transport them into a childcare setting, which is pretty cool. Or if that K-12 student who's under the age of 12 also then goes to a childcare center because their school ends at 3, they bus them for free on behalf of the parent to that new program. So if we can't find the funding through municipalities and Board of Eds to do a true universal 0 to 5 program, then there are creative solutions to fill in the gaps, like busing, like supporting providers.
Maybe Sky and Ava, I'd love to kind of just hear from Ava, kind of the what you see the stakes to be this year in terms of, the battle for funding, with the legislature.
I'll chime in and kick it off. The legislative session is right now legislators seem like they're digging their heels on not wanting to raise taxes. And not to go into the whole history of the last 20 years of Connecticut's economy, but it's common knowledge that we went from being in a deficit and things being very difficult and wanting to be more mindful of our budget, make sure that we have our fiscal house in order. The legislature did that. They're very proud of that. And now we've had some significant gains through playing the market, that we have a surplus of money. So there's a lot of coalition partners, nonprofits who are looking at how we can use that surplus money and our new fiscal independence to support families. In the childcare conversation, it's trying to find, it's great that we have a surplus. That's fantastic. But the reality is that the surplus that does exist is nowhere near the money we need to fill in the gaps to support teachers and support families, to truly support a transformative change. Childcare needs an investment of close to $2 billion annually, not 100 million here, 200 million there. And in that investment, it reflects on comments that both Jennifer and Patrice made on this call. This investment is not just about giving a provider a raise and walking away. It's making sure that we're creating opportunities for business growth in childcare deserts. It's making sure that we're backing up those educators with bachelor's degrees, with associate's degrees in early childhood development and education. All of that costs money. So there has to be a holistic approach to how we look at childcare and the future of childcare.
Thank you. I so wish we had a little more time here. I will say, it's been a joy to work with each of you. I know that with Riverfront, just to give the volunteer partners on the call a sense of the work. I know with Riverfront, we have a group of partners working with Jennifer and her team and board on a strategic plan to, look at the organization, also about, potential for growth. with Patrice, we're focusing in on the development of the organization and the leaders and structures for strengthening the organization for now and into the future. And Ava, our work with Child Care for Connecticut has really been from a startup to a variety of different ways of getting to support that coalition. And it's exciting to see that now be a staffed coalition that can, advocate for this really transformative change that we need to see here in Connecticut. So with that, although I wish we had so much more time, I know there's more to come here from social impact partners. I'll say we have an upcoming December 11th here in Westport. Look out for that in your emails. We'd love to see everyone there, and we'll speak more about what's happening in the coming year. We'll give everyone their afternoon, and thank you again for your time and being with us today.